Welcome to School of Statistics. Today we will discuss the pre-concept of question number 157. The concept of question number 157 is related to the randomized complete block design. In this video, we will discuss what is randomized complete block design and when we use randomized complete block design. We will also discuss the concept of experimental units, what is block, and what is the difference between treatments and factors. First question about randomized complete block design is when we use randomized complete block design. Randomized complete block design is used when the experimental units are one-way heterogeneous. Now the question is that what is the meaning of one-way heterogeneous? To understand the concept of one-way heterogeneous, we take a simple real-life example. Suppose we have a group of allergy patients. If all the patients have same age group, same sugar level, but different blood groups, then the patients are called one-way heterogeneous. It means when one characteristic is different among experimental units, then experimental units are called one-way heterogeneous. To develop the better understanding about the concept of heterogeneity, now we take a simple example of two-way heterogeneous. If all the patients have same age group but different sugar level and different blood groups. In this case, the patients are called two-way heterogeneous because in this case, the two characteristics, the blood group and sugar level, are different. Now think for a moment, if you are a researcher and dealing with the situation where all the wheat plots have same fertility level, same moisture level, but different level of water underground, then which experimental design you may use? Now we discuss what is difference between factors and treatments. To understand the concept of factors and treatments, we take a simple real-life example. Suppose you want to treat the high cholesterol patients with the help of medicine and diet. Then medicine is called one factor and diet is called second factor. Now the next question is what is treatment? The different types of medicines, medicine A, medicine B, and medicine C are called treatments of factor 1. And different types of diet plan A and diet plan B are called treatments. Now to understand the concept of experimental units, we take a real-life example. Suppose we have a group of allergy patients and want to investigate the effect of a certain medicine which is used to treat the allergy patients. In this case, all the allergy patients will be our experimental units. Think for a moment. Suppose you are a researcher and want to investigate the effect of number of waters on the growth of trees. In this case, what will be the experimental units? In this section, we will discuss what is block. Basically, block is the arrangement of experimental units into homogeneous groups on the basis of some common and similar characteristics. In this way, the formation of groups is technically called blocks. As we discussed in the previous example, we have a group of allergy patients with same age group and same sugar level. Hence, the formation of groups of patients with respect to age group and sugar level are called blocks. To develop a better understanding of blocks, suppose we have 12 allergy patients, out of which 3 have B positive blood groups, 5 have B negative blood groups, and 4 have O negative blood groups. Now we find the blocks on the basis of different blood groups in such a way the blocks should be homogeneous within block and heterogeneous between blocks. As you can see, in block 1, all the B positive blood groups patients are present, and in block 2, all the B negative blood group patients are present. And in block 3, all the B O negative blood groups patients are present. In this section, we will discuss what is block size. To understand the concept of block size, 2 points must keep in mind. Number 1, size of a block is equal to number of experimental units present in a block. Number 2, block size is equal to number of treatments. It means size of a block is equal to number of experimental units is equal to number of treatments. Now, what is the meaning of size of a block is equal to number of experimental units present in a block? As you can see, there are 3 experimental units are present in block 1. Therefore, the size of block 1 is 3. And there are 4 experimental units are present in block 2. Therefore, the size of block 2 is 4. Now, the question is that why RCBD is called complete block design? This is very important question regarding RCBD, that why RCBD is called complete block design. First of all, we discuss what is the complete block design. In RCBD, it is the strict condition that each treatment should be present in each block, and if each treatment is present in each block, then block is called complete block. Think for a moment, if there are total 3 treatments and 2 treatments are present in block 1, then block will be called complete block design or incomplete block design. Total 3 treatments, but in block 1 only 2 treatments are present, then block will be complete block or incomplete block. Now we discuss question number 157. In a randomized complete block design, there are 4 treatments and 3 blocks. Then what will be the number of experimental units in each block? As we discussed earlier, the number of treatments is equal to number of experimental units. In question number 157, there are 4 treatments. Therefore, the experimental units will be 4. Therefore, the correct option will be C is equal to 4.